morning, guys. So today is the day I'm going to get my HSG done, and I don't really know what to expect. I didn't really plan this out too well because honestly, as I speak, I'm late for class, which is why I'm dressed like this. I'm in school for dietetics, and I'm on my way to class now. And yeah, so I was requested to wear white scrub pants and a just regular white tee. So this is what I look like. And then from class, I'm going to leave and go to the hospital and, yeah, get the HSG done. So I'm just taking you guys with me on this journey, as I always do. So anyway, just want to say hey, on my way to class, and I will check in with you guys once I get out of class. Okay, guys, so you will not believe what I had to go through to get here. So I just got out of class. I couldn't miss the class because it was the first time that we were meeting in person. It's techniques of food preparation, and this was the very first time this semester that we were meeting in person. So I had to go to the class, and the only time I could schedule this was, it's a very specific test. HSG is very specific. It can only be scheduled within a certain amount of time due to your menstrual cycle and ovulation and things of that nature. So the next time I'll be able to schedule it would have been next month. And I'm like, I just want to go ahead and get this out the way. So I just had some executive decisions that I had to make when scheduling the appointment. I knew I had class today, so I was just like, okay, I'm just going to try to make it both work. So I got here barely on time, but I'm just waiting on them to call me back there and let's get this party started. So basically, with an HSG, they're going to test my fallopian tubes to make sure that they're open and there are no blockages and that everything's good to go in order to, conceive and have a baby. So she wanted to do this when I had surgery back in 2021, but back then I really didn't want to do it because, I just went through surgery. I just went through I was just like, okay, that part of my life is over. I don't want to go through that. But now I'm, finally at the point where I'm like, okay, let's do this. Let's go ahead and check and make sure everything's okay. So if it's, if there's anything physical wrong or that I need to know of, then I can address it. And if not, then I know it's a spiritual thing, and then I can handle things from that aspect. So I'm gonna go back over here. I've already checked in, signed in. So I'm gonna go back over here. My husband's over here waiting, and I'm gonna go back over here in case they call me and finish the check-in process. I've been through a lot this morning, so let me go ahead and finish this up. Okay, so this is doxycycline, and this is what my doctor prescribed to me for this procedure, and it just helps to prevent any type of infection because they are injecting ink into a sterile environment, which is my uterus and my fallopian tubes. And so this will help to keep any type of infection from occurring. So every time you get an HSG, they're going to recommend or prescribe some type of antibiotic, which I hate, but it is what it is. I'll just take some probiotics when I get home to help to rebalance my gut friendly bacteria. So it's only 3. You can see here it's only 3. Take 1 capsule by mouth before the procedure. My address is at the top of this, and I don't want to show that, of course, so that's why I'm holding it like this. And then so I completely forgot to take this. My husband, I was just sitting in a waiting room just a few minutes ago. He was like, did you take your antibiotic? I'm like, oh my God, no. Because when I tell you guys I have been rushing, I got out of class at 10:30, and I had to be here at 11. This is halfway across. This is across town, so it's gonna take me at least 25 minutes to get here. So I'm balling down the highway to get here on time, and I got here, but I completely forgot to take this. So I already took it. I just took it, and so now I'm just sitting in a waiting room, waiting on them to call me, because I hadn't even started my paperwork yet. So I have to start my paperwork, and they get my insurance. They already have my insurance on file, but I have to pay my copay and yada 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 yada. So I guess it's just one person working up there because I've been here for a minute, and like, she's the lady in admissions, the one lady that's behind the desk at admissions is still with this one lady. She's been there for like 15 minutes. So just waiting on my turn so I can go ahead and get this out the way.
So took some angled pictures, kind of trying to see if we could see more of the tube. Again, just kind of faintly still see some more of that tube. This might be a little bit of your right tube, but again, it's kind of questionable, okay? Because again, you really should see it pretty well, kind of like we saw it on that other picture here. And even then, you kind of lose it through here, but you can definitely see it here. And so really don't see, much, if any, of your right tube. And this has kind of started to kind of peter out where you can't really see it anymore. And then I think this was the picture I took after that last push. All right, so there really wasn't any more filling of the tube, probably not really any significant filling of that tube. Okay, so at that point, your tubes look to be blocked. All right, certainly we didn't really get good filling of that tube, and we only got kind of faint partial filling of your left tube. Okay. And again, we gave it a good push, all right? I mean, I could kind of see the uterus expanding, really not much filling, further filling of this tube after that last push, and we gave it a pretty good shot. So that's the case, unfortunately.
Okay, so they're both blocked.
Yes. Yep.
What causes that?
So, good question. We do a lot of these tests, and certainly we get tubes that are blocked, sometimes. Sometimes you don't know. Some people come in, you don't know. Now, you've had surgery before, so any kind of surgery, was it, did they go basically through the cervix, or did they actually open you up laparoscopically?
Yeah, they opened me up laparoscopically.
Yep. So, now it's certainly not a common cause of any kind of tube blockage, but basically anything that can cause, scarring in or around the tubes could potentially cause them to be blocked, okay? Other things that could do that, anything kind of infection or inflammation anywhere around the tubes, whether they had to do with the tubes or not, could do that. So you say you had a history of appendicitis, and your appendix happened to be near this tube, that's going to cause inflammation, and then could potentially cause scarring, and then could potentially cause the tube to be blocked. But certainly a lot of times you don't know. There's no history of anything like that, surgeries, things like that would, point to that. So a lot of times you just don't know. Okay. And that's pretty much it. Any other questions?
So aside from this procedure, is there any other way to overcome?
Yes. So another question we get pretty often. There are surgery. You can have surgery to attempt to open or repair a blocked tube. That's OBGYN doctor would do that kind of surgery. Now, what I always tell patients is, as far as who would be a candidate for that, risks, benefits, success rates, things like that, I don't know the answer to. Certainly that it is done. We occasionally will get patients in here who have had surgery before, and we're basically checking to see if the tubes, basically the surgery worked. They will check it in surgery, but then, weeks later we'll do this test to see if the tubes remain open, etc. But again, as far as kind of, risk, benefits, kind of who would be a good person to have that surgery, kind of all that'd be a better question probably for Dr. Eastep. But yes, possible. Yep.
Okay. And there is no way to do this with any anesthesia.
We don't do it here, no, because again,
it can be done somewhere else with anesthesia.
Not that I've heard of, but again, I only do them here, and I've been here for years and years. So I mean, I know that they are done other places, but we do a whole lot of them here, probably more than anywhere else.
Okay.
So, But I mean, it's a question that you could ask Dr. Eastep, because, an OBGYN could do this procedure. It's not that it requires, it is always a radiologist it's that we use x-ray, so radiologists do them because we use x-ray, and most OBGYNs don't have an x-ray unit in their office. Does that make sense? Because they do other procedures similar, but they're use ultrasound, things like that. So you could ask Dr. Eastup and see, but yeah, no, we don't typically do
Is it
that.
supposed to be like
Tilted off to the right?
tilted?
Another very common question. Your uterus happens to tilt a little bit to the right. That's totally normal. There's very few people probably that have a perfectly centered, untilted uterus. So
Okay.
pretty much everybody's going to tilt right, left, forwards, backwards, or some combination. Yours happens to tilt a little bit to the right. Totally normal. Yep.
Okay.
Yep. Everybody's different. Very few people are symmetric and perfect like books and pictures. Yeah.
And the uterus, I mean, it looks okay from the looks of it. Like
Certainly.
nothing.
Nope. Nope. Now, I mean, this is not maybe the 100% best test for looking at kind of the lining of the uterine cavity. There's another test called a saline test or a sonohistogram, which, you know, typically OBGYN doctors do them because, again, it's with ultrasound. And a lot of times we get patients from the clinic right across the street. That's basically all they do is fertility stuff, and they do a lot of patients come in and have this done, and they go and have that done, which basically is the same thing. You just put saline in the uterus, and then you look at it with ultrasound. It basically kind of opens up the uterine cavity, so you can really look at the lining of the uterus really well. We get a pretty good look with this test, and it looks good. But again, it's not the 100% best test. This is really the main point of this test is looking at tubes.
Okay, gotcha. And so it's blocked towards the end, like where it meets the egg.
So this one's kind of proximal because I really don't see anything that I can say with 100% certainty is tube. There might be a little filling of this, but I would say that that's kind of blockage close to the uterus. This looks like it's blocked about it in, you know, we call that the isthmic segment, and then the last segment is the ampullary segment. So it basically got filling of the isthmic segment, but really no significant filling of the ampullary segment. So it's kind of, I kind of think about it 2/3 is like that, and then the other third is that last part that's bigger. So it kind of widens out a little bit as it gets closer where the ovary is. We really don't see any filling with that. So kind of
How is it supposed to, like, where is it supposed, where are you
So
supposed to
that's
see
everybody's different too with that. So I see tubes come up this way, down this way, that way, that way. You know, stay close to the uterus, kind of stretch out. You know, all that's normal. It just depends on where your ovaries are, kind of like it depends on where your uterus is. So, you know, my guess is this ovary's probably over here. This ovary's probably somewhere down here. But all that's still very normal. Yeah, it's all
Okay,
very
I
normal.
see.
Yeah, everybody. I get that a lot. Why isn't it? Why did this one go that way and that one go this way? And it's all very normal. Everybody's different.
But they are definitely blocked, both of them.
Yes. Yeah.
And no amount of pushing or getting more of that dye in would open them up.
I mean, that's kind of hard to say because, again, when we do this, and certainly I've done many cases where we've tried to open a tube, and, you know, sometimes we can push really, really hard and the tubes don't open. Sometimes, you know, you can only tolerate so much and the tubes don't open, or they do open. So, you know, for me to say with 100% certainty if we pushed harder and longer, could we have gotten that tube open? Maybe, but maybe not, you know. And so, you know, I will only push until the patient will not tolerate it anymore, you know. And there's a point where I know that I've pushed as hard as I'm comfortable pushing, you know, and still, you know, not seeing an open tube or getting the tube more open. And that's when I'm going to just stop because, you know, all I'm doing is causing pain and getting no benefit from it, you know. I mean, I could have pushed harder, you know, but not a whole lot harder, and you couldn't tolerate it, and that's all you can do, you know, and that happens sometimes.
So, but you did, like, get it open some.
A little bit, yes. Okay. Yeah, because on this first picture, I didn't really see any of it, you know. Let's see, so here, I mean, maybe that's a little bit of it there. This is my first picture, as opposed to this where I can see it, okay? So maybe just a very faint filling right in there, but can't really see much there. So maybe just a little bit of trickle of the dye got through there. But this is after the bigger push, and I could see more of it, but still not all of it. And again, with tubes that are open, like very normal, very open, it does not require a lot of force. Okay, so you just kind of keep pushing, and the uterus fills in, and the tubes fill in, and you know, and some take a little bit more, you know, but if they're open and normal, and I'm gonna call it a normal test, it does not require me to, really push and cause that kind of cramping and discomfort. They will just open, relatively easily. Certainly some people have bad cramping, but they do open, So that's why I, say that these are blocked, because, despite what the amount of pressure that I gave, they did not open, or did not fully open. So, basically assume they are blocked.
Okay, and then, so those are my options then, to see if someone can surgically open them, or that's it, isn't it?
I mean, there's, other fertility things you can do, IVF and things like that. So where they harvest eggs and basically do that. But that's kind of the, again, a little outside of my wheelhouse, but yes.
Oh, yeah,
I mean, as long as your ovaries are functioning and your uterus is doing what it's supposed to, then you could potentially do IVF, which is basically taking the ovary or the egg out, fertilizing it and putting it back in the uterus.
Yeah. Okay. Did you have any other questions? I think that's it.
Okay.
Thank you for your
Well, you
help.
had some really good questions, and you're a trooper. I know it was pretty awful, but you did great. And no more questions?
I believe that's it for me.
Okay. All right.
Okay, so I'm just leaving the doctor's office now, and I just got the experience of an HSG, and my friend tried to tell me a bit about the experience, but since I had no knowledge about it, I didn't really know what to expect. Like, even when she was telling me some of the details of her experience and what she did and what she went through, then she was, I was like, I didn't really know what to expect, because I never been through, the experience before. So basically, the HSG was excruciating. It was very painful. Y'all, I just felt like I was going to vomit. I felt like laying on that table, I was like, okay, because I've always been like the person who said that, I'm going to have a natural birth, ain't no epidurals here, none of that. I was laying on that table and I was like, you know what? If this is what natural birth feels like, screw this. I'm going to have me an epidural, and that is what it's going to be, because the pain level, the cramps, it was just so severe. I wasn't expecting it. I thought I was someone who tolerated pain pretty well, considering all that I've been through with fibroids and the cramping, and fibroids and cramps, and everything that I've been through. I thought I was someone that experienced pain or processed pain pretty well. Baby, when I got on that table and the guy got to pumping that dye and the stuff in me, oh my God. But anyway, okay. So you guys did hear about my experience, back there. I let you listen in on it. So you guys did hear when I was at the hospital how the HSG went. He did say that both, not one, but both of my tubes are blocked. One is more blocked than the other. The left tube, my left tube is more blocked than my right tube. So that was fun to hear. But it also, I'm also thankful that I did go through with the HSG, because now I know what's up. But it was just so painful. I could not take it. I just couldn't take it. Like, I had never been in that much pain in my life, that kind of pain. And I'm, like I said, I was just like, if this is what natural birth feel like, okay, because every woman who's had a natural birth had, they told me, okay, it ain't no joke, the pain ain't no joke, it's ridiculous, it's this. Everybody has their own different experiences, and I don't mean to scare anybody who's listening to this video, but they're like, it feels this way, it feels this way, it feels this way, and and I'm just like, yeah, that's your experience, that ain't my experience. You're not me, I'm not you. You know, we're two different people, you know, and so I'll be able to handle it. Like I had fibroids, and the hell that I went through with fibroids, I can handle natural labor. Huh? Man, if that's what it feels like, I'm like, oh no, bring on the drugs, bring on the epidural. No. So yeah, it was an experience. Even though this experience did not turn out the way that I would have hoped, I am very thankful for it. I can't say that enough. I am very thankful that I did go. I'm thankful for the results because, you know, I do have options. And so, yeah. So, all right, guys, it's been real, and I'm going to go home. Well, I'm going to go in my home now, and I will talk to you guys later. I'll see you in the next one. Bye.